I am going to walk through kind of where to start with your benefits. Okay. So, the reason why I'm doing this is I recognize that usually at the beginning of the year, when our benefits roll over, I make sure that I'm logging in, that I have all of our information handy, and can just dive right in and do what I call healthcare planning, right? Healthcare interaction planning. And I did not do that this year. December was super crazy, like ridiculous. And I just hadn't had a chance. And I was like, you know what? This would be a really great way to kind of show people where to start, get to know me a little bit, and then what I do, and kind of reduce some of the angst and the overwhelm when it comes to dealing with your benefits. Because I know from my personal experience, I usually just kind of I'm very, because it's what I do, I'm very comfortable with it, but I've heard a lot of people say, like, where do I start? So nice and easy, right? It's the beginning of the year, it's February. We usually have a couple of resolutions that we set, and this is a way to kind of really get on that path to those resolutions. Anybody that hops in later on, they can definitely ask questions as they come in. You may hear a ding, you may not, so I'm not sure. But yeah, so if you're setting resolutions, this is a really good way to get to know your resources to propel you towards, or to at least help you maintain those resolutions, especially if they're health and wellness related. I'm going to start sharing my screen. If you have any trouble seeing my screen, definitely give me a shout. I do have my eye on the Q&A. So we're going to kind of jump in. A couple things that I hope you glean from this. That one, it's easy to get started. This isn't a hard thing to do. I also kind of want you to walk away, and this is a 4-week kind of process, right? I'm not going to just do this once and then leave you to your own devices. We're going to walk through the process as if I was walking you through the process if you were a client and I was working with you. But I want you to be able to kind of pool your resources so that you know where they are, get a hold of them, be able to access them regularly, get used to them and play around with them. And then as we go through the process, really familiarize yourself with kind of the whole thing with making your health a priority, and that starts with knowing where to start, where you are. House rules, expectations, just want to please ask questions. I want this to be as engaging as possible. I want you to get as much from this as possible. And the portals that I'm going to show you today, and that I'll probably be using through the program, will be actually my online stuff. And most insurance companies are kind of looking very similar, where you have like a login and then you have different tabs and you can bounce around. We'll talk about that a little bit today, but it's not hot and heavy. Like, this isn't going to be a full on, I'm going to overwhelm you and you're going to walk away with your head exploding. This is just really skimming the top and just getting used to looking at where you can focus, where you need to focus, right? Because there's so much going on. I also wanted to kind of walk you through, I don't know if you can see my screen. So there's a couple of things going on. I'm recording because there are some people who, once they register, I will send out the recording to you. You do not need to take copious notes. I know that is the kind of learner I am, and I love that. But I want you to really pay attention so that your questions can be answered. Or if there's some follow-up stuff going on, you can always go back to the recording and say, oh my gosh, at such and such a point, I really need help with that. Okay, so this is being recorded, as you can see here. We're not doing any polls today. This is an introductory, and then here's the Q&A part. So I am going to, and timing. This is going to be it's really an introduction. I'm not trying to take up your entire Sunday evening. I know we're all getting ready for the week. Some of us are off tomorrow, and some of us still have to go in. But I don't want to take up too much of your evening. And so this is probably going to be about 20 to 30 minutes, give or take. Okay. All right. So I'm going to hop right in. This is a portal that we use with our particular insurance coverage. It's a federal employee program, and the federal government offers way too many choices. It's part of how I kind of got started with this. Is my husband sat the laptop in front of me and was like, I don't know what to do. Because we switched from my employer benefits to his, and he had way more choices than I did. I actually went from a a high deductible plan option to his, which was standardized. So this is just really quickly. As you can see, you're going to see the logo of the insurance company. They'll do a welcome benefits plans. And here is where you'll see all of the options usually that's offered to you through if you have an employer. If you're going through a subsidized program, if you're going through even the healthcare.gov, those companies still may have you decide which one of your plans or which of the plans they offer that you're participating in. So it's good to have your insurance card handy while, when you start doing this, and I will give you homework. Yay. But it's good to have your insurance card handy so that you can identify which of the plans that you're participating in. I also recommend, I like to do the contact us a lot, and I'll just click on that really quick so you can kind of see. It depends on states. Like, so Blue Cross Blue Shield covers a lot of different states. You'll have to click on wherever you're located, and they'll give you a whole bunch of information from there. But we'll go back to the home page. So a lot of these companies, as you can see, there's this whole wellness push. Excuse me. There's a push for wellness and preventative care. And when you walk into your doctor's office and you do your annuals and you're doing your checkups regularly, sometimes those won't have a copay or incur any out-of-pocket costs because that's the push that insurance companies are going. If we could catch it early, then maybe we could get a handle on it and it won't cost us as much. And that's real, right? So most insurance companies are looking to reduce their costs. So they're figuring now that if they go into this preventative measure and we can catch it, it's not going to be as, it'll be a little more client, patient, user friendly, right? Because we're doing right by our clientele, but it's also going to help their bottom line because if they catch it early, like I said, it's less that for the treatment plans and stuff that they have to do. So they start off, a lot of times, oh, this is our incentive program. If you blah, 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 then you'll get blah, blah, blah. So as you can see here, you'll receive $40 for every eligible goal that you complete. And this is, I'm going to say, from both a healthcare professional, an end user, and then a person who provides support and education around utilizing your benefits and your health insurance and really understanding how to interact with them. I think this is a really good way to not just incentivize you, but it's nice to have a couple extra dollars in your pocket, and it's nice to be rewarded for the work that you're doing. And as I started before, we're talking about resolutions and doing different things to improve and maintain our health. This is definitely a way for you to kind of motivate yourself, right? And depending on, if you have a family who's on the same plan, you guys can be competitive. That may work in your favor just to kind of keep you motivated. If you have friends or coworkers or colleagues in the business space, I know we can be a little, it can be a little lonely, right? So maybe you can talk to some of your friends in your network and figure out how, if you're not a Blue Cross Blue Shield, or if you're an Aetna person or something else, they may have similar incentives, and you can kind of cross match those to position you to have that competitive nature that'll help you, keep yourself engaged. So just wanted to bounce through. When you go onto the website, what I usually like to have people pay attention to, and it really depends on what you're coming here for. If you're coming to find a doctor, that can be a little daunting, frustrating, but that's one of the places you could go. They do have a login and a sign up. Most portals now have both a login and a sign up. So if you haven't already signed up, you have a way to sign up to get their information. They walk you through how to use your benefits. Telehealth is a big thing. Nursing lines. And if you have any questions about telehealth, I know that's like a new buzzword nowadays that people are using. Yep, just want to check. That's a new buzzword that people are using, and I kind of have mixed feelings. It really depends. Again, what are your goals? What are your needs? Because I talk about the difference between urgent care, emergency room, and then going to see your actual practitioner, your provider, and the levels to which you why you're doing that. And I always recommend that if you can get into your doctor's office that you do, because urgent care and emergency room care are not going to give you that follow-up care that you need. And the majority of the things that we're going to the ER for and the urgent care do require some level of post-care follow-up, right? Some check-ins. If you don't have that option, they're okay places to go. Just know that you need to have a plan B follow-up in place in order to maximize and maintain whatever it is they did to kind of get you even keel and over that hump, right? In that acute situation or that emergent situation, that you're going to have to go to somebody because you want to make sure that you're staying in line with what you need to do, which is best for you. So they start talking about online health coaches, and this is kind of a thing that, and I'll show you because it goes into from online health coaching. They also have Blue Cross offers what they call Blue 365, which deals with health and wellness discounts. And as I say, it's free to join. They give you discounts on certain things. There are a whole bunch of avenues that you can go into, right? So there's all the deals, which there's a whole lot going on there. If you want to do apparel and footwear, if you're a runner or you're starting to work out, that may be a really good thing for you to go to just to see what's out there. Because I know when I started working out, I think I had like really old workout clothes, and it felt a little better to go to the gym with something that wasn't holy and like strings were falling off of. So yeah, if you can kind of take advantage of that, that would be helpful. And then they have fitness centers and stuff, and offers when it comes to fitness. So we'll click on that and see just kind of what they offer. So it depends, right? So in this section, as the wellness offering, they give you different things you can click on, and it allows you to kind of navigate through. And you can see fitness and TRX and Aftershocks and Garmin and all that good stuff, Kate Spade. And so they give you a different, you can click on them and it'll tell you kind of what options they offer there. There's hearing and vision. Of course, hearing and vision, very important. If you can't see, we definitely need our eyes, and it's great to be able to hear what's going on and be participative. And as you can see, they have a young lady singing with what looks like a grandparent. So you don't want to lose your ability to hear and interact with your family. Um, so that's some of the things. Home and family nutrition, travel. I mean, these are just perks that employers are really starting to offer in tandem with the generalized health benefits. So, and then the next thing would be, I always really push these. So ours is CompPsych, and these are what they call EAPs, employee assistance programs, and not a lot of people know about them. They are a great way to get confidential assistance with all kinds of things. The first thing that comes to mind, of course, is mental health. And then there's other behavioral health and wellness where they have some practitioners who participate with like CompPsych for financial assistance, elder care, really helping you, find resources for, if you're having babysitting issues. I'm trying to think. I know with the here with the ancillary kind of perk system, there's acupuncture, I think, which falls underneath here somewhere, maybe home and family. So there's some non-traditional ways of treating things. A chiropractic may fall into either Blue 365 or the CompPsych. So really getting a hold of the resources that you have. And some of this stuff is on the bottom, on the back of your insurance card, and other stuff you really have to dig, right? And it could be frustrating because depending on your employer, depending on your situation, and I know even with some of the ACA plans, it's not at the forefront to be able to get this information. So you really have to make phone calls, you have to dig, you have to ask questions when you're signing up for insurances. You have to see if they offer, the EAPs. And usually the EAPs are through employers. There are some additional work-life benefit kind of things like Blue Cross that can be added in tandem with the higher end, insurance plans through the ACA. And then for the assistance programs, I know when it comes to Health Partners and I'm trying to think United Health, because they're in that vein with the Medicare and Medicaid, they are starting to put some of that in play, just moving towards that preventative type atmosphere and really wanting to give people an option to take care of themselves act proactively instead of just doing the managed care option. So that's the CompPsych EAP, any kind of family support services. That's what the EAPs or employee assistant programs usually offer. They also help with stress as far as finances. I think I mentioned that maybe there's some lawyer type services that are working in tandem with some of these EAPs. And I just wanted to double check. I'm looking at time. Okay. All right. So that's kind of running through the resources, just top level, high end, um, going to the websites, figuring out where those websites are. And a lot of times your insurance company is going to offer most of their information online now. It can be really hard to get something. Oh, I see I have a question. Okay. Yes, free gym. Yes, yes, yes. Free gym memberships. Yes, they do. So they do either do free gym memberships or they'll do reduce, right? And one of the good things about going through your benefit or your employer or your insurance plan that offers these things is that whereas you have a contract with a gym, if you go sign up to a gym on your own, the work-life benefit or the ancillary, I call them ancillary benefits, so the additional benefits that are offered through the insurance company, like our 365, it gives you access, but you don't have the same requirements as far as the contract, right? So it kind of gives you a little leeway where you may not have had it if you go with like a LA Fitness where they have you in contract for 12 months and it's a whole lot of convoluted process to get out. So I kind of like it for that because it gives you the freedom to try these things out, see if they work for you, but you're not beholden to them. You haven't signed over your left arm or left leg so that you can, stay in this contract and you can't get out. So I wanted to touch on kind of now that we've looked at the portals, and kind of done an overview of what information it gives to you, the wellness resources. And I always recommend your insurance company is doing some work to incentivize you, but it's also trying to move you in a position to be healthier, right? It benefits both you and the insurance company if you're doing things to maintain and improve your health. So you want to take advantage of these. These are things that are being covered, paid for, offered, and they do require work on your part. As I said, when it comes to looking at the benefits plan and understanding that there's certain things that you need to have available to you when you're coming to the portal. And that would be your insurance card, so you know your plan or whatever plan that you signed up for. If there's an email that says this is the plan that you have, because that's going to help you really be able to figure out, hone in and focus, where do I need to go, where do I want to go. And I think I mentioned earlier about when you come to the website, what are you looking for? Are you looking to find a doctor? Are you just looking to play around and really get to know your benefits? Are you looking to see what else is offered, covered? So a lot of times I'll do an audit with people getting closer into open enrollment at the end of the year, and it's like, all right, how did you use this? Did you really use it? You had the platinum dental plan. How often did you go see the dentist? Like, was it really worth it for you? And really kind of delving into how they're using the resources that they had and if it's worth it. Do they need to bump up? Do they need to bump down? Or can they stay right where they are? And this is, as I said, also, they do a lot of blogs where you can go in, and I do tend to lean a little bit more towards the blogs from Blue Cross Blue Shield. I'm trying to think. They're not coming to me. Medscape. what WebMD, Healthline, they vet their people a little bit more when they're giving information, and they give you resources. So I'm always looking for a resource that provides me additional resources, right? That they're not just pulling this out of their hat. They're not just talking about what their experience is, but they can take their experience, provide it for you in a way that's relatable, and then say, okay, I'm not only just saying that this is my experience, but there's research behind it. And there are some things that we experience where you may be the only person who experiences it, but maybe it's a known reaction or a known outcome that they came across when they were doing their studies. And that's just always helpful to be able to help you direct the conversation that you're having with your provider, and to really empower you as the patient to go in and say, okay, I've done some research. I'm not coming here with a full on Google encyclopedia, but I've done some research and have certain understandings about what I think and what the expected outcomes are. This is what my experience is, and let's really have a talk about how this has affected my lifestyle. So that's a little deep. Usually, I like I said, I like to try to skim, but that's why I recommend these tools and these platforms, because they are providing you with additional resources to really be able to empower you to maintain and manage and actually go beyond and actually participate in and participate in your health and interact with your providers. I don't think we interact enough. I think we just want to get what we want to get. We're a little intimidated sometimes, which is how we relate to it. And then we just want to come out of the system because a lot of times we have what I call negative healthcare experiences. So I bounce into that. Now, why is this all important? Okay, the next week when you come in, you'll have some homework, and I'll talk about that in a little bit. But I really want you to go in and kind of really play around with your benefits and your health and what is available to you, because then that's going to position you to be able to really come in next week and start asking some questions. And as I'm diving in and you've already played around with the platforms, you go, oh, okay, yeah, that makes sense. No, actually, I tried it this way, and this is what my thing looks like, and so forth and so on. And that will. Oh, and I wanted to show you one thing. I'll do that in a second. And that'll make this a little more engaging, and it'll make it more relatable to what your situation is. Because I don't want to just talk about me and what we're seeing and walk you through our process. I also want you to start walking yourself through your own process. I did want to show you something really quick. This is, I'm going to open this up a little bit. So this is a sample summary of benefits. This is from a previous presentation I've done. And I pulled this off of the one of the the Independence Blue Cross personal choice plans that's offered through healthcare.gov, as you can see. Shout out to healthcare.gov. And this is where you would go in. So you would go into the portal. They should allow you to, once you log in and sign up, access your summary of benefits, right? And this is what we're looking at. So the summary of benefits is really going to tell you information like what is your overall deductible, right? So participating providers, it's $5,500 per person or $11,000 per year for a family, and that's over the entire year that costs. And then, and I'll talk about these terms when we go in and start looking at the actual portals. But the deductible is pretty much what part you're responsible for, right? The insurance company, you have to pay that before the insurance company really kicks in. The whole participating providers is what gives you the quote unquote, and I'm really simplifying, but the discounted rate, right? So if they're in network, they're agreeing to only charge you a certain amount. But if they're out of network, they have not agreed with the insurance company to only charge you a certain amount. As you can see, preventative care is usually at the top of the list. And there's a website. If you Google preventative care, actually the healthcare, here it is. The healthcare.gov has a page specific for listing preventative care benefits. And this is really helpful, right? So when you go into your primary, and I had this happen, I went into Yes, my primary picked it up, but I went into my OBGYN. I went into my OBGYN. They charged me as if they were a specialist, which they are, but it was my annual. So I had to just go back in and I looked at the healthcare.gov and I was like, oh, no, this is my annual. This is preventative. Had a conversation with my insurance company. They confirmed, and then had to have a conversation with the doctor's office, who then dealt with the billing and blah, blah. Sometimes it's not that simple, right? So sometimes you got to make 50 phone calls to get $5 back. And I always recommend that you make the phone calls before you go in, because it's better for you to have an idea of what your costs and out-of-pocket costs are going to be, which is why you will go to the summary of benefits before you walk into the doctor's office, because there's so many variables. And humans are exactly that. And it's better that you know your plan, because then you can walk in confident and say, I hear you, that's what you're used to maybe charging, but I know my plan and I know that this is what my copays are, or this is what I'm responsible for. It just puts you in a better position when you're dealing with doctors' offices, third-party billers, and insurance companies, because it's sometimes it can be harder to get your money back than it is to not spend it in the beginning, right? Okay, cool. So that's the summary of benefits. I'll really go hot and heavy into this, but I wanted to give you a nice little overview how they break down the coinsurance and preventative care screenings, and what telemedicine could cost you, what a CT or a CAT scan or MRI could possibly cost, and is that covered? Just what's going on with your prescription drug. So this is it's not the most exciting place to go. I get excited when I've read the ACA. I started reading it and I got excited about that too. So I'm just that kind of person. But I get excited when I see this, because it's like, great, I know, I kind of have an idea and understanding of what's coming, right? I know what my part that I have to pay is. I know what's covered with my family. So when I'm making these appointments, I don't go, oh my God, I'm gonna give them my insurance card and then just pray that, this is okay. It's like, okay, I'm giving you my insurance card. I paid my copay. I know that we haven't hit the deductible yet, so I'm probably gonna get a bill for, so that's just, knowledge is power. And I wholeheartedly believe that knowledge is power, and it just positions you better to have more informed, empowering conversations when you're going in to interact with the healthcare. So it actually positions you to interact, as opposed to just going in and running and hiding and waiting for that mail to come in. So yeah, this really positions you to actually interact and have real conversations with your providers. So I've done a couple walkthroughs, just some really brief over the top. I'm being mindful of everybody's time, and just showing you kind of what the portals look like. So any questions moving forward? That was a lot of information. I'm just, yeah, a lot. And if they come up, again, I'm popping in and taking a look. So if any questions come up, let me know. Yeah, I think I'm just double checking, make sure, the walkthrough examples. Yeah, I think that's it there. So, question, yes, yes. You're on your site now. Okay, awesome. Wonderful. Is there anything that looks similar to what I showed you that helps you with your site, Tracy? Yes. Okay. Okay, great. Awesome. So the homework will be for you to like really delve into your site. Now, and this is something that I'm thinking of as you're saying you're on your site. So your site, and I'm just bouncing into mine. It may only give you resources in regards to the actual benefits, right? So whatever your health benefits are, you may really have to dig for your ancillary, in addition to type services, right? So the Blue 365. And there's a way for you to tell if that's something that you're offered. Sometimes your card will have it. Sometimes you just have to call. And sometimes, it's really frustrating too, because sometimes you call your insurance company expecting them to know or have an idea or be able to direct you to the other places. And for like, for instance, CompPsych, I had to really work on that. Like that wasn't something that was easy for me to find. And I think I had to call like, not customer service for the insurance, but customer service, like employee services or something, to really help me delve into that. So play around with the portal that your insurance provider offers. Get familiar with that. Set up your login and everything, because I want to be able to next week really sit and go through that and answer any questions you may have in regards to that. And then if you're not able to find any ancillary, we can delve into, okay, maybe we could share and see what each other's doing, and then maybe play around with the indexes on the website or something if you're having trouble there. But awesome, I'm glad you're on the site. I'm glad, like I said, they're starting to really move into this kind of uniform look, so that if you're leaving one insurance company, you go to another one, you're not comparing apples to kumquats. It actually makes sense for you. And it also allows you, if you're looking into an insurance company, and this is a good idea, if you're ever looking to switch insurance companies, go to their website first and see how user friendly it is and what information they offer, before you jump over, hopping out of the frying pan into the fire sometimes. This will give you a good heads up. So yeah, so great. I'm glad you took a look. Awesome. I'm excited for you and can't wait to hear all of what comes from perusing that. And if it's overwhelming, say that too, right? Because it'll be like, okay, well, that's overwhelming. What are you just going for this, or do you need this, or whatever the case may be? Now, next week's topic, moving in, because we're about 26 minutes in. Next week's topic is accessing and navigating the portals, right? And then understanding what kind of people we are as we're going into that. And when I say that, I mean, are you somebody who's really, you're just a get in and get out? It's like, I need this one thing and I just want to get in there and I want to go. Or are you somebody who's like, okay, as we move through this process, I'm willing to sit and kind of plan this out and understand how my deductible is going to affect when I go to the doctor, and, those kinds of things. So just having an idea as you're going into the portal, as you're doing your homework and playing around to get ready to follow up next week, having an idea of the way that you're approaching your health and the way that you're approaching the healthcare system, is going to be really helpful. And that's probably going to be one of the questions that I ask when we hop in next week. Who do you think you are when it comes to interacting with the healthcare system? And I'll share some personality types and talk to you about what they look like. I'm going to say I'm a self-achiever, but I've kind of backed off of that a little bit. And thank God my kids are getting older and healthier, so I don't have to be at the doctor's like as soon as they sneeze. So yeah, so that's next week. Homework. Check out your portals, see what information you can find from your insurance cards and what access you can get there. Next week's topic, we're going to be accessing those portals, navigating through, and really jumping in and playing, because we're going to build on this. So it's going to go from just skimming the top here to accessing the portals, getting to know the portals, and moving into planning and implementation. So step by step, just slowly, put some time aside, maybe 30, 40 minutes in the week to just get in, spend some time on it, and then move on to the next thing and build up. That's it. I'm sitting here looking for any more questions. I'll give it a few minutes, seconds, maybe. And yeah, well, I wanted to thank you for your time. Have a wonderful, wonderful, got a question. Yes, ma'am. Oh, you're welcome. No worries. Thank you for your time. Have a wonderful, wonderful week. Enjoy your Sunday, and I look forward to seeing you guys next week. All right. Bye.